Hello, beautiful people, welcome back. I'm happy to be here, and it's my 1.5 year update. And sorry so much for being so missing here. You know that English is not my mother tongue, so I'm going to try to be quick because I'm not the best person to explain the process in English, I know, and I apologize for this, but I know some of you followed the process, so I just want to give you an update on what I'm up to. This is gonna be, I think, my last video in a while because I don't think I need to update or to catch up on many things like in the following years. Maybe, I don't know, when it arrives like the 5 years post-op, but for the moment, I'm gonna focus on this. First of all, I'm gonna reply some of your questions, like to cover all your main concerns, and then I'm just gonna summarize like the positive things and the negative things, and just my conclusion from this procedure that has been sharp surgery and orthognatic surgery or double jaw surgery, pushing them, forward. So first question. How does it feel to breathe after the surgery? Well, now I just came from the street, so I'm a little bit like catching my breath. But it's, I don't know, it made a change like from 0 to 90. I wouldn't say like 100% because my nose is kind of small, so sometimes when I have a cold or something like that, I just can't breathe like 100%, but it went from 0, like I was, imagine I was working and I was trying to shut my mouth and I couldn't breathe at all, and I had to reopen my mouth. So it went from that to the moment, to the point that I can breathe perfectly through my nose. After that, and also as you all know, like the snoring and the sleep apnea, it went like drastically, like from snoring a lot, not resting, to 0. So this is something like, I don't know, it has been a game changer, like a life change for me. And after, like some of you were concerned about how about the first 3 months. The first 3 months is like a roller coaster. The first month, the first week is like the worst, as you know. And they say that the swelling peak is day 3. Then it goes slightly down day by day, but very slowly. I would say the first week is just don't look at yourself in the mirror and you'll be fine. And then just go like drastically, like to being a normal person at the end of the first month or first month and a half. I mean, let's put this in brackets because it's not for you. You're gonna see yourself weird for months, but people who may not know you, maybe they see you and they say, okay, this is normal, but you will know because then you will have the residual swelling that it lasts for 1 year or 1.5 years. Then after the first couple of weeks, you start being able, at least myself, I was starting to eat some soft food, not hard at all, but very, I don't know, like omelette and things like that, like pasta or so. And then I started like go out or to see some friends after the first month and a half. I went back to work. I was in sickness absence for 1.5 months, and then I went back. This can variate like from depending on your job, but for example myself, I have to talk all day long and with a computer and meeting clients and so on, so it was a little bit tricky for me. So it took me 1-2 months like to be back totally. And then second month I started to travel a little bit, and then it went better and better and better, even though I was seeing myself and I was like, I don't really look natural. My smile, my gesture, it wasn't totally right, but yeah. Then another question you normally ask me is braces until when? So what I did 6 months before sharp surgery. It was, I have to say, 2 years and a half now. And then I had the sharp surgery, then I mixed with braces and also the Invisalign, and then I went on to orthognatic surgery, and then for 3 months or 4 I had nothing because they couldn't scan my mouth because the machine didn't fit in because of my opening. I could barely open my mouth. So and the 3rd month or 4th after the double jaw surgery, I got my Invisalign back, and I was with them like for about 4 months, and then it was over. So let's say almost 4 years old. Yeah. And does it permanently solve the breathing issues? I gotta say that yes, snoring, yes, the sleep apnea. In my case, yes, the mouth breathing. But in my case, for example, I have my tonsils, I have very big, and actually went to in Spain we say otorrino, but I don't know how you say, like the doctor for the breathing and the mouth and the tonsils and the ears and so on. So he saw my tonsils. I'm gonna show you. And as you can see, they are pretty big, so they told me that I have to get them removed. And because when they get more swollen, maybe it's more difficult for me like to sleep maybe. So it's not. Imagine I solved like most of the problem, and actually they said me like congratulations because you made the right decisions, which is very reassuring, because you don't feel like, okay, maybe I didn't make the progress I should. No, it was right, because if not, I couldn't breathe at all. Sometimes, like, I would keep going with my sleep apnea and not resting and so on. So it was the decision to make. But on the other hand, yeah, it doesn't solve the other 20 or 10%. Another question about the chewing issues. In my case, it also was like, I don't know, a game changer again, because I was only chewing by this side of the mouth. I'm gonna show some pictures of how my occlusion was. Actually, I was having a look on the first video I uploaded here, and I was like, wow, freaking out by what a drastic change it has been. And I didn't thought, I wasn't thinking back then that my occlusion and my teeth were so bad, but now that I'm seeing them, it's like, wow, they have like half the width that they do now. So in this case now I can eat whatever, eat by the 2 sides of my mouth, and it's so much comfortable in all senses you cannot imagine. Another thing, an 18 years girl asked me, it was about the eligibility for the surgery in order to, considering the different ages. So I would say that until, I don't know, 20 years old maybe, you can choose between another procedures, not only surgery, because the bone is not still that hard, it's growing, it's developing, it's not as mature. And so in these cases, the earlier your parents or you put a palate expander or a machine or another mechanisms, it would help in order to not go through this whole process and surgeries and so on. But after you become an adult, let's say after 20 years old, or depending on the case, for sure you have to go to the best specialist you can, or the doctors who will diagnose it, or the orthodontist. But after this age, it's not really possible to, in those cases, if they are severe, like to get the problem corrected or solved, unless you have a W surgery or an orthognatic surgery or a SARP surgery. In those cases, that requires palate expansion. How about the swelling evolution? Well, I already said about how the time goes a little bit, but one thing that really concerns me or concerns you, because you are texting me on Micah Goodstone / Just Surgery Instagram, you're asking me like, oh Micah, I'm so concerned because I don't recognize myself on the mirror. I see myself so weird, I'm starting to regret and so on. And I get so, I don't know, so sad for you, because it's still a long way to go until it's been 1 year or 1 year and a half. You are just even starting. For example, this side of your mouth is like, I would say, like Homer Simpson, you know, like a little bit swollen and weird, and you look like a doll kind of. The smile is very weird, and you're like, I don't know. You try, but your muscles are not responding properly. So I would say just sit on it, take it easy, be patient, and embrace the change. Sometimes, some weeks you're not seeing change at all. Some weeks, for example, I went on a trip to Italy last summer, and when I came back after walking all day long, my family were like, oh, your face look more natural now, like, and that was because the swelling, just when you walk and when you move, it just the swelling goes down, and the residual swelling that I got just improved dramatically. So yes, be patient, there is no shortcut here. Also, when talking normally, I would say like 1 month and a half, 2 months as well, when I went back to work. Because also your opening, it starts to improve. It depends on the person, and don't stress out, because, for example, I did my surgery, and I say please to my surgeon and my orthodontist. He was Federico Hernández Alfaro at Instituto Maxilofacial de Barcelona. And my orthodontist, she was Julia at Cima Dental in Madrid. And both of them, for example, how he works, my surgeon, he does minimally invasive incisions. So basically the surgery lasts for very short time, and the incisions are very minimal. So what they try is that the recovery, it speeds up a lot. And actually the day after my surgery, I'm gonna post a video on the side. They made me drink on a glass, and I was like, no syringe. And they said, no syringe, just go ahead. And it was all dropping because I wasn't feeling anything. But it was it just speeded up the process so much. And the second week I was eating soft food. So also they told me, as I was explaining, like to exercise my mouth, like the opening with a stick or something, like to practice the opening. And by the 2 months or so, I was like opening, not enough, you can see it in my videos, but I was like, okay, now I can speak. It wasn't, my opening, it wasn't like it is now. For sure, that is pretty good. I don't have, compared to before, it wasn't like, it doesn't make much difference. But yeah, I was speaking since day 2. So, and normally speaking from day 60, let's say. Then my sensibility, I would say now is 80-90%. It's not totally back, no. Here I think it's the worst, this area, and they say that normally it takes up to 1.5 years, 2 years, like to come all back. Sometimes it doesn't come back all. In my case, it's not something that concerns me so much. It's not that I have a piece of meat here and I don't feel it. No, I feel that a little bit less. Also, the price, it was like so important in everyone's case. But I have to say that this can be made for the, the public system or the, through an insurance or so on, because it's a health issue. So in my case, I actually started the process through the public system, like the public sanitary system, but in the end I was like, no, this is gonna take forever because of the pandemic as well. So I researched and I had this feeling with my surgeon, and I saved for a long time. I saved money in order to have the surgery with him. But if not, and they finance it and so on. So there are so many options in this case. The price of my clinic, it was 25,000 no, surgery plus orthognatic surgery by maxillary advance. It was 20,000. Pretty expensive, yeah, loads of saving and not spending no holidays, nothing, but it was worth it, I guess. Another thing, the risk of recession, or I forgot the name, but of this coming back again. As they told me, some doctors, it's minimal. According to my age, the surgery is remade and my current position of the bones and so on. And now it's pretty fixed all, and the evolution has been great. But of course, you have to pay attention to the things that you do, to your daily habits, to keeping an eye, on breathing through your nose, and for example, positioning your tongue on the roof of your mouth, or some correct way of eating, to not push your teeth with your tongue, things like that. So sometimes it helps to go to myofunctional therapy or to a physiotherapist specialized on the face muscles. In order to keep these changes and to take care a lot of your mouth health, your gums and so on, because I have to say that my gums suffer a lot, and I suffer from gums recession a little bit, and this is how they look right now, but this went back a little bit. These are going back a little bit. So I don't know, after you go through all of this, you can kind of chill down a little bit, because you're like, okay, I'm just calm down now. But you still have to go to the checkups, to the cleaning, to so on, because in the end, your mouth has suffered so much, like teeth have moved so much, and you have to take care of the results. It's not that sitting on them now, like chilling. And last not least, about the bad things, I would say yes. So in my case, the things that worry me the most, they've been the gums, and also a tiny gap has opened here. You can see, and it's because of the gums recession, and sometimes I have some pain on them, so I'm really trying to take care of them right now. And also I hear some noises when I do like how do you say when I do this, or like a movement, I open my mouth wide, I hear like crack. like something like very wild, and I get scared. It only happens like once a month, but I get a little bit disturbed, like I don't know. I stress out because I feel like something is gonna break and I'm gonna have a problem. But now it's just the crack. And then for another month, I don't hear anything and I don't have pain whatsoever. So it's very weird, but this happens. Another thing, that the precision of this surgery, of the advancement, has been like so millimetric that in the end, sometimes these teeth, the lower teeth, are pushing forward a little bit the upper teeth, in the sense that kind of it tries to be a class 3 now. I was a class 2, like retrognatia or jaw retrusion, and now it kinds to try to be try to go ahead a little bit. So yes, it worries me a bit because sometimes I feel like pain in the upper teeth. So, but I don't know if it's my muscles, the one who do this, because I was used to do that before because of my incompetence. So my muscles were pushing my jaw forward, and now that it's not necessary, I feel that maybe I do this still, and I have just when this happened and I start to feel some pain, very, very subtle, like I promise, like nothing to worry about, like maybe once a month or a couple of times. I just chill down, don't put pressure on my jaw, and it goes away. So yeah. Another thing, I wanted to share this. I don't know why, but another thing I started in the physical aspect, not now in like in the health area. It was that the fact that they pushed me the two jaws forward. It made the feeling to me sometimes that this was a little bit back. You know, like I would say like a monkey face, like a chimp. I'm gonna show you a picture so you can understand what I mean. Like too much this forward, this projected, and this a little bit backwards. So, and also the fact that they shortened my upper jaw, and it felt like I had a little bit more wrinkle because of the less tension that I had on my face. Let's say that in my case, my face has been kind of shortened a little bit. So I was feeling like more wrinkles, like this, a little bit less full, even though overall I was looking younger and my face projection was better. And this made me think of a case of a girl who she had a surgery for class 3 case, and the surgeon suggested her to have a cheek implant, and I was like, wow, this is a whole face like change. And she actually explained to me that in her case she didn't have cheek, the whole face bone projection, like it was like poorly projected, let's say, in the bones structure. And so she said no, and then she was like, she regretted it. And then after the surgery that I started to notice these little changes, I was like, wow, maybe this actually happens. And when they shorten the bone and they push this side of the face forward, this stays in the same place. So I went to a doctor, and he told me, well, actually, because of the dimensions and projections of your bones now, I have to say that he told me as well, like, congratulations for the job, the work your surgeon has made, because it's great. And your occlusion and your teeth and your smile, everything is great. It's a great work. But yes, it would help to have this a little bit more projected, like to balance it out a little bit better, and for your, to give your skin the support it lacks in a way. And so I just got a little bit of acid hyaluronic just to try a little bit how it would enhance just a slightly bit. It's nothing like actually my family didn't realize, and it was very, very subtle just to see how it worked. I don't know if I'm gonna keep doing it because it's very subtle, as I said, but yeah, it's something I was like, okay, surprised about. I don't know if I was disappointed, but it actually just made me think a little bit about this aspect. I went through all the negative or all my little concerns, just to summarize the positive that is it. I have to say that is much more than the negative aspects. It's just the improvement on my breathing. I can shout my mouth now. If I compare again to the video I was talking about, my closing is like so forced, like I cannot shut my mouth properly, like this. and now it's just so, it comes so natural, like I don't know, like I don't have to be so self-conscious anymore. It feels like I can just focus on being me, whereas before I was at work or I was talking to someone and I was covering my mouth, grabbing my chin because I had a little bit of complex. Just makes things a little bit easier. So I'm so glad of that too. Also the chewing, I said that it's so easier now. I think that's it. As a last advice, I would say that you wear please your retainers all the time, because sometimes now as I told you, I'm relaxing a little bit about this process and forgetting all I went through. Like, your memory is so selective, and in the end now we focus more on the positive and we forget a little bit about the bad time we had. And I have to say that sometimes when I wear my retainers, I put them on and I after some days of not wearing them, and it feels like wow, like a little bit of pressure on my teeth and some pain. So please keep on with the checkup, the cleanings, the retainers, so on. I have a fixed retainer here and a fixed retainer here, and then the removable retainer that I'm taking for sleeping or for some hours during the day. And last but not least, just before recording this last video, I don't think I need to catch up on something else like in a few years, as we say, no news, good news. But I was listening to a podcast like embracing changes, and you know that some people rejects like or reacts very negative to changes, and I see that in some of the messages you write me, and it's so understandable. It's not that I don't get it, because I was like, wow, so self-conscious all the time, like looking at every single change throughout the progress of my recovery. But embrace the changes, because you are gonna see yourself weird for months, for weeks, for a couple of years, and this is for the better. Normally, like after the swelling and the procedure is done, most of the cases are for the better, but we just have to trust the process and your healing, and to adapt to your new phase, and yeah, and love yourself throughout the process, and surround yourself by people who loves you the same and throughout the changes. So that would be it. I apologize if I'm not gonna be so much here or so much on my Instagram. I repeat, you can text me there, but I don't go as frequently as before now, because I have to focus on a new era. I think it's very important as well to grow and to enjoy the benefits and just move on a new stage of your life. So forgive me if I'm not that constant here anymore or replying. Thank you so much for being such a supportive community. I send you all the strength, all the good energy, all everything I can send you, and yeah, it will be fine. Send you kisses, and see you very soon, and good health and good luck.